proverb, health is wealth, has become a reality in the post-pandemic world. The grim realities that India faced during COVID's second wave in 2021 was a wake-up call to many in India's power corridors. A resolve was taken that India would never again face such shortages, and work began on war footing to get the health of the country back on track. Come join us and watch India's remarkable ongoing development in the healthcare sector. The COVID pandemic confirmed the long-standing rule of governance that a prosperous country is one with a healthy population. India, already in the process of implementing changes to make the nation healthier, has doubled down on its efforts to create a robust healthcare infrastructure after the pandemic took a massive toll on its population. The states and federal government have been working hand in hand to improve healthcare in the country and give individuals living in even the most remote areas of the nation access to all levels of healthcare. As part of the initiatives undertaken to improve healthcare at all levels in the country, Prime Minister Narendra Modi recently inaugurated the All India Institute of Medical Sciences, AIIMS Bilaspur, a premier-level medical institute cum hospital equipped with ultra-modern facilities in the country's northern Himachal Pradesh. AIIMS Bilaspur cost approximately $170 million USD to build. The hospital is equipped with 18 specialty and 17 super specialty departments, 18 modular operating rooms, 750 beds, and 64 ICU beds, which will greatly increase the quality of medical care in the area.
बीते 8 वर्षों में हिमाचल की विकास गाथा को नए आयाम पर पहुंचाया। बिलासपुर एम्स एक और बदलाव का प्रतीक भी है और एम्स के अंदर भी ये ग्रीन एम्स के नाम से जाना जाएगा। पूरी तरह पर्यावरण प्रेमी एम्स, प्रकृति प्रेमी एम्स।
Under the Pradhan Mantri Swasthya Suraksha Yojana scheme, many new AIIMS facilities are being built. So far, the establishment of 23 new AIIMS have been approved under the scheme. Of the 23, the 7 AIIMS in Bhopal, Bhubaneswar, Jodhpur, Patna, Raipur, Rishikesh, and Bilaspur are fully operational. OPD facilities and MBBS classes have started in another 7, while MBBS classes have started in another 5 more institutes. The dynamics of the Indian healthcare industry are significantly changing as a result of the development of healthcare systems in the most isolated regions of the nation. India endeavors to improve all aspects of its healthcare system, from primary healthcare centers to hospitals providing tertiary treatment. The country allocated $11.28 billion USD to the Ministry of Health and Family Welfare for the current fiscal year. It is also planning to introduce a credit incentive program worth $6.8 billion USD to boost the country's healthcare infrastructure. India has all the necessary requirements for this industry to flourish exponentially, including a sizable population, a strong pharmacy, and well-developed medical supply networks. Telemedicine and remote healthcare will also bridge the gap in health access between urban and rural India. For example, the National Health Mission is a program wherein the government aims to provide universal access to equitable, affordable, and quality healthcare services that are accountable and responsive to people's needs.
Today, the availability of services following the creation of the National Health Mission and the creation of policies which detailed the involvement of both the public and the private sector and the role that they play in a congruent manner to benefit the population of India has been heartening.
India's consistent efforts to provide its citizens with quality healthcare have already begun to pay off. Infant mortality in India fell from 66 to a little over 27 per 1,000 live births from 2000 to 2022. And life expectancy at birth increased from 63 to over 70 years in the same period. India is one of the developing countries with the highest healthcare expenditures, and this trend is anticipated to accelerate in years to come. In the past 2 years, Indian healthcare has shifted its attention to innovation and technology, and 80% of healthcare institutions intend to boost their investment in digital solutions. The Indian healthcare system is on course to rank among the top in the world, further enhancing Brand India's reputation as a global leader. The global hotel industry was severely harmed by the COVID-19 pandemic. Strict travel restrictions imposed by countries trying to curb the spread of COVID had a significant impact on supply chains and income for hotels, restaurants, travel, and other leisure activities. After a 2-year slump, the sector is gradually returning to pre-pandemic levels. The Indian hospitality industry has particularly accelerated with the government's renewed push to bring attention to the country's underexplored diverse ecosystem, vast heritage, and culture. India's Ministry of Tourism laid emphasis on promotion of domestic tourism and launched the Dekho Apna Desh initiative. The ministry also announced various fiscal relief measures to revive the tourism sector after the pandemic. The government's initiatives to revive domestic tourism have resulted in record tourist footfall in the Union Territory of Jammu and Kashmir. According to the Information and Public Relations of the J&K government, around 16.2 million tourists have visited the region since January this year.
We've had so many tourists from different parts of the country internationally coming into Kashmir this year. I think it's wonderful to see so many tourists coming here, enjoying everything. We've ensured that these tourists get the best of facilities, and our major tourism players have played a major role in this.
Many other Indian states are too experiencing an upsurge in the number of visitors and travelers. For example, the number of tourists in Goa has exceeded pre-COVID levels since September of 2021.
Goa is with the full bang, with the open arms, welcoming tourists back into Goa. It may be a charter tourist, or it may be a foreign tourist coming on the FIT, or domestic tourists, which Goa they have made as their first destination, India, that as our Chief Minister calls it, tourism capital of India.
According to the Investment Information and Credit Rating Agency, the Indian hotel industry started off on a promising note this fiscal year, with the country's luxury hotels registering 56 to 58% occupancy in the first quarter, even though it was not peak travel season. Centrally supported initiatives like the National Strategy for Sustainable Tourism and Responsible Traveler campaign and the National Integrated Database of Hospitality Industry have made travel and tourism even more organized and accessible. Leaders in the tourism industry have been extremely pleased with the government's active response during and in the aftermath of the pandemic.
The Indian hospitality industry has enjoyed moderate growth over the past couple of years, but there's certainly some great potential that lies ahead. This is a nation that is rich in culture and diversity. The World Economic Forum ranked India in its Tourism Competitive Index 65th in 2013, and it has grown to 34th in 2019. And now that the recovery is well and truly underway, I'm sure that this number will rise in the future.
The India Brand Equity Foundation, IBEF, predicts that the Indian travel market will grow to $125 billion USD in the 2027 to 2028 fiscal year. Despite the initial slowdown with the COVID-19 pandemic, the sector's growth outlook is positive, with revenues on a sharp upward trajectory. With a focus on the country's rich heritage, planned expansion, and steady rise in hospitality standards, India has loudly announced to people around the world that no matter where you are, India is ready to welcome you.